Welcome to Fertility Associates Auckland Clinic. When you come in, please come and report to reception and then take a seat and our staff will be with you. This is our doctor consulting area. We have 6 consulting rooms and 11 doctors operating from here. When you come in to see a doctor, you come into these rooms and the doctor will talk to you about your fertility history and make a consultation and order tests for you, and that kicks off the process for us here. We do some of our morning scans here, so when you're underway with an IVF cycle, you can come in here and have your follicles checked for size and progress through the cycle. These are our drug discussion rooms, and what we do here is we have 2 private rooms where we can sit down with the patient and issue drugs and give them any information they need on their cycle. This is our patient waiting area when you're coming in for treatment, so if you're here for an egg collection or an embryo replacement or just waiting to see a nurse, you'll wait here. These are 2 of our recovery rooms, and patients will come in here before and after treatment, and it just gives them a comfortable space just to relax. And you'll notice it doesn't look like a hospital room. We have lazy boys rather than hospital beds, just to make it comfortable. People are welcome to bring their support people, whether that's a partner or a family member, and there's plenty of space. This is one of our 2 theatres, and in this theatre we do egg collections and embryo replacements. And when you have an egg collection, the eggs are then passed through the hatch into the laboratory where they're fertilised. The embryos are passed from the lab through into the theatre, and the doctor replaces the embryo in here. This is our nurse's office. We have about 15 nurses operating from here. So when you call in, you'll be speaking to someone in here. The nurses are here between 7:30 in the morning and 5:30 in the afternoon. During an IVF cycle, it's actually best to wait until the nurses phone you with results, because in the morning we're often in theatre, early afternoon we're getting the results and we're assessing the next steps of your treatment, and then later in the afternoon we phone you with the plan for the next day. We have a recorded menu, so if you call our main number 520-9520, you can then make a selection to come through to the nurses. Alternatively, you will be issued a DDI when you commence treatment, and that will allow you to call directly the nurse that's involved in your treatment. Our centre is here in Remuera, and we operate a clinic on the North Shore, and we pretty much do everything there except the treatments. So if people are having scans and they live or work on the shore, they're welcome to go into that clinic if it's more convenient. We can also dispense drugs, and they can have a doctor consultation or even counselling over there. Once a month one of our doctors operates out of Whangarei Hospital, and we can also dispense drugs etc. in Whangarei. The accommodation we recommend is actually at the Novotel, which is just in the next door building, and they have accommodation more at the top end in the Novotel, but they also have the Ibis, so they've got the cheaper side as well. Very handy just being across the back fence. Our main laboratory is here, so it's where we're handling the eggs and the embryos, where we store everything as well. So this is the main treatment place. Blood tests, it's important for people to remember to use their white card, because that identifies them as a fertility patient and means the results come back very quickly. So we get the results in the morning, we then assess in conjunction with their scan results and give them the next steps that afternoon. So it's important that they follow the rules a little bit. Scans are done here, usually between 8 or 9 in the morning, but if that's really inconvenient for you, we can do it at a later time during the day. People can have scans here at the Remuera Clinic or on the North Shore, or if it's inconvenient to get here, they can do them at other centres at their own expense.